To you. How are you doing? How's the weather in your area? How's the weather with you? How's your mind? How's your body? And how is your soul? Is it this music you're listening to? I don't even understand what the music is about. I just know that my dearest colleague, Ifechukwu Emoide, chose this song. The inspiration, I asked him, I said, it's sunny side. It rained in the morning. And, the weather just has a way of making people feel lazy somewhat. And then on my show that's supposed to be sunny side, is this kind of music you go and play. So please, forgive him on my behalf. I know he did not mean to. That's all I can say for now. Having said that, my name is Dennis Wallo. Bring out your mobile devices. Yes, you. I'm talking to you. Bring out your mobile devices. Now, put on your data. Immediately, don't waste my time. Go to oneplay.ng. I said go to oneplay.ng now. I'm serious here. Go there and buy your ticket. 500 naira. Because 2 people will win 25,000 naira each on OnePlay on my show today. Are you on OnePlay? Don't waste my time so that you will not say that I've not helped your life. I'm helping you now with information that will help you get 25k. Buy your tickets now, 500 naira. Buy as many tickets as possible. You see, on Jude's show, I was listening, 2 people won, and they were so excited with 5,000 naira each. My own show is not going to be any different. So please, help me to help you. I'm aggressive with my own marketing. OnePlay! On the sunny side, we'll be giving out 25,000 naira to 2 people. All you need to do is go to oneplay.ng. That's the website. Buy your ticket on the sunny side with 500 naira only. If you cannot do that via the website, use the USSD code *347 *880 *6#. *347 *880 *6#. And in due time, in my show, listen attentively because who knows, you may just be one of the lucky winners on today's draw. Having said that, shall we dive right into the conversation for today? Sometimes when I craft topics, it somewhat seems like, all these subtitles or subheadings you have in a class. Your teacher is teaching and they tell you the topic is this. And then they tell you that today is the put heading, underline it, put 1, 2, 3, 4. You're right. Today is one of those topics. And why we are having that conversation is because maybe, just maybe, if we understand why we do certain things, when the outcome is a certain way, maybe it will justify our reasons. Or maybe to put a question mark on why we even did it. Factors considered when seeking healthcare from a health facility. Let me start by saying this. People receive treatment at different health facilities for different health needs. As a matter of fact, yesterday, I stopped by a pharmacy to buy drugs, multivitamins, and inhaler, as well as, basically multivitamins for my young one who was sneezing and doing coughing. I saw someone seated at that pharmacy receiving medication. The person sat down. I saw a drip line as well as a drip, and the bag was colored, So it means they have injected the drugs that are supposed to get into the person's system. The person was seated there at a pharmacy, and it's not the first time. I mean, sometimes I walk into that place to buy something, and I see someone taking injections there. I think the only thing I have not gone there to witness is someone delivering there. All right, I've gone there and the mother brought her child, that the child swallowed something, that they should come and help bring the child. I've gone there and they say, the child put something in the nose, come and help. I've seen a lot. I've gone there and the child put something in the ear, and I don't even know if they are nurses or they are just people that dress in the uniform and have been learning the job, and some way, somehow they feel like, okay, right now I am a nurse. So people receive treatment at different health facilities for different health needs. If you go to my village, everybody that owns a medicine store is a doctor. Yes, Go to Nembe, Ogbolomabri to be precise. Doctor, in fact, there is one particular one that this is where the medicine store is. You buy your drugs. By the side, you will see a bed, 2 beds. You sometimes see people lying down there to take medication. And so people are now on admission in a drugstore. I kid you not. Whether these facilities have been licensed to do so or are qualified to do so, one may never know till there is a problem. Repeat patronage is possible because certain factors are considered. Most common of those factors is the dem sabi work factor. Either dem sabi work or im sabi work. Go meet that man where they sell drugs, im sabi. Go there hospital for there, dem sabi. Go that clinic for there. Those people dem sabi work. Oh, me? I have been taken to a certain place at one time during pregnancy because the woman sabi work. In short, the story had it from the person that took me there that what hospitals could not do, this woman could do it. In fact, the road to the place, I was trying to navigate. I was saying my car should not get into a ditch. I was that scared. I really wanted to know. Curiosity made me go there. And when I got there and I saw the place, and I said, people give birth here. Someone answered, yes, oh, she's been walking. Sure, you get the one where they refer from BMH. Say the pikin inside the belly, it be like say the pikin sit down with stool like this. You know, Greek come out. But by the time this woman handled the woman, pikin come out. Professors, they are white, then they come born here. Some of those lecturers for so school, then they come born here. I say, eh? Say yes, oh, she's sabi. And then they said, go and lie down, let them check you. I said, I have a hospital, I'm receiving care. Say, go lie down, maybe I know what they tell you. I know go. And she gives herbs. She delivers, and people have been testifying. So dem sabi work stands number one position. And then followed by maybe proximity and affordability. So back to the sabi work. You receive treatment there, or you probably give birth there, and you became very well without any complications. Chances are that you will go there. On the show today, there's a trending story. It was in our news bulletin. Some of us have followed this story from when it first broke out. Someone was lost to the cold hands of death. She was 7 months pregnant, and then she started feeling pains in her stomach. She was rushed to a particular clinic, the Standard Maternity Clinic here in Port Harcourt, Borikri, Churchill. To be honest, it was at that hospital that she gave birth to her other children. You see what I'm saying? Dem sabi work. Who knows how many children she gave birth to there? But this case was different. She gave birth through CS. The operation was run by a doctor, and it was successful. But his beloved had lost a lot of blood and needed blood to support her life. But you see, the doctor says she does not do that in her hospital because she's a religious person from a certain church, Jehovah's Witness. First, you forget your religion before running a hospital, according to the person. Second, you run an operation in your hospital with Nigerian NEPA light, which failed during the operation before they started running to put on the generator. My beloved was killed by the doctor's religious belief. The family was tricked to sign for the operation because of their selfish interests. The lady's life is lost. So it could be childbirth. It could be any other form of care. It could be you have malaria. It could be you have... Think of the so many reasons why people go to visit the hospital. It could even be an accident and you are still conscious And maybe you decide, you can tell the people that are trying to help you, take me to XYZ health center or XYZ hospital or XYZ clinic. What factors do you consider when seeking health care and natal care from a health facility? I don't just want this conversation to be about childbirth, delivery, CS. No. Let's look at it holistically. Healthcare, as little as or as minor as. I don't think any disease is minor. Begin. Sometimes you discover that the minor diseases will take someone's life. I hear people die of malaria even in 2025. So there's no disease that is smaller. But for any healthcare needs at all, you need to visit a health facility. What factor do you consider? And then, of course, natal care. What factors do you consider before seeking healthcare and natal care from a health facility? Let's talk. 0817-923-0002 and then, of course, 0817-923-0003. Again, 0817-923-0002 and 0817-923-0003. WhatsApp and Telegram number for your WhatsApp and Telegram messages is 0809 030 6416 0809 030 6416 on X at Nigeria Info page, and of course our Facebook page remains Nigeria Info 92.3 ph. Call screeners in standby to take your calls first before passing you on to me in the studio. So when you call, the first voice you would hear will not be my voice, but that of the call screener. Felix from Port Harcourt. Hi, Felix. Welcome to the sunny side. Go ahead.
Yeah, good afternoon.
Good afternoon.
Okay, the experience in the Nigerian medical system is really pathetic. Mine is an advice, because if you are not careful, some of these medical professionals can undo you. I had an experience. I don't want to mention the name of the hospital. My wife was having a flu. She was about 4 months pregnant. So she was having this dropping of blood. I took her to that particular hospital. When we got there, she was admitted. In the next 10 or 15 minutes, I saw them running her casket, running up and down. They were wheeling her to the theater. And I asked the doctor, what is happening? He said that they want to evacuate her. I said, how? I don't understand. I brought my wife to the clinic. Don't I have right to know what you want to do to my wife? You say you want to evacuate her because she was having dropping of blood. I said, no, you can't do that. Do you know what it takes to impregnate a woman? It's not possible. Before you take any decision on my wife, I'm supposed to be a partaker of that decision. I angrily asked them to discharge my wife. I took my wife to another clinic. When we got there, they stopped that bleeding. And as God may have you, she delivered a bouncing baby boy. But they had gone into theater to evacuate that baby. If not for the fact that I intervened. So anybody that's going to any clinic must ask questions. As a man, if you're married or you're a man, you have a kid, if you take them there, ask questions. What do you want to do? What injection are you giving him or her? What millimeter of injection are you supposed to give? Because these guys take us for granted. They are all businessmen. If they evacuate my wife, I'll end up paying like 1 million naira or 500,000.
For the evacuation?
Yes. They will take around a percentage, because all these resident doctors, they have percentage. If they do CS, they have a percentage.
Really?
If they do evacuation, they have a damn percentage.
Hold on. You see, this conversation we are having today is a threefold conversation. I don't want us to exhaust all of the angles today. Let us focus on factors you consider. Now, before you chose that health center or that hospital for your wife, what came to mind? What were you thinking of?
No, I was, it's an emergency situation.
Oh, it was an emergency situation. It was the nearest hospital to you?
No, she took the aromatic snap. And she immediately started having flow, these droplets of blood.
Was the hospital the closest to you? That's what I want to know.
Yes,
okay.
It was closer to me.
Oh, okay.
So I look at what do I do now? This is the closest hospital to me. I have to rush her.
The hospital is different from the hospital that she had registered for antenatal care.
Yes.
Okay.
So here is the first point of call. And I believe that they have to do something to stop the flow. Rather, they went into evacuate her. So if I hadn't asked questions and followed up, no, you can't do this. You have to tell me. And eventually, I took her to another clinic. They stopped the bleeding. And that baby was kept. And 9 months, she delivered. So these are the things we need to look at. If your wife is going through antenatal, start in the hospital there. So
after the evacuation attempt by that said hospital, did you take her back to the hospital where she registered?
Yes, I took her to where she registered for antenatal. And the doctor stopped the bleeding. In fact, the doctor was not even on seat. He called because it was night. He called the nurses. I don't know what he told the nurses to administer on her. I don't know what they did, but the bleeding stopped. And that baby was saved.
Thank you, Felix. Thank you.
So if you're going to hospital, on a final note, if your wife is pregnant, tell them you want to be in the theater. Why should we be delivered?
Well, she'll be delivered of the baby.
Very, very important.
Very, very important. So Felix just said something. Proximity. As at the time there was an emergency, he was thinking proximity. Meanwhile, his wife had been registered to deliver at another hospital. After all said and done, he still took her back to the original hospital that she had been receiving care since the inception of the pregnancy. So he probably spent more time in that other hospital. And yes, he asked questions. And only at the point of asking questions did he discover that something is not right. Let's be going. Let's start leaving this place. Let's leave. So there was some form of involvement. What if the wife had gone to that hospital alone? Maybe Felix was not in town. Maybe he had traveled. Bebo, get that my belly they do me. I'm feeling a certain type of way. Go to the hospital now. And, she just felt like, let me just go to this nearby hospital. At that point in time, nobody will probably talk to her. Maybe she gets to a point where she cannot even speak. And anything can happen. John from Rumokrushi. Hi, John. Welcome to the sunny side. Go ahead.
Yeah, good afternoon.
Good afternoon, John.
Yes. My contribution is just like you have said. What makes you to choose the hospital somehow? What do you have in mind? I have an hospital they're using actually. Very, will I say good? I don't want to mention the name. But my daughter had a problem. I took her there. She had a small lump by the neck.
Okay.
Very small lump, something like a lump by the side of the neck. So the hospital said they are going to operate. I said, why? They said, no, they will pray though. I said, they allowed me to go home and think about it. The following day, I went to another hospital. Let me say precisely, I went to teaching hospital. After a series of tests, today, tomorrow, did this test, then I now see the chief consultant. Eventually, the consultant look, say, oh, girls, you need to brush your teeth well. Go and gargle your mouth. Use salt. And take this tablet. After 2 weeks, come and see me. Before the end of the 2 weeks, the lump disappeared. So, Sometimes I feel all the things I experience. That is the end of the lump, which we will have resulted in operation for a girl of about 15, 16 years old.
Interesting.
So that's my contribution. Thank you.
Thank you. They said it was a lump. She needed operation. The father took her away. The father took her there. And went to another hospital and just said, brush your teeth, do like this, take these drugs. And that was it. The doctor should have written in bold at the entrance of the hospital that blood transfusion is not allowed in that hospital. I think he or she should be prosecuted for that negligence, and people should have a comprehensive knowledge of a hospital before patronizing them, because most of them have both success and failure history. Godwin, I agree with you. But this is it. There's a particular hospital in Port Harcourt. I know someone very close to me that gave birth there successfully. I went there, I saw her, I saw the baby. I also know of 2 people who have lost their lives at that same hospital, giving births. So even if I ask questions, my friend will probably tell me from her own personal experience, those people are good, there's a bit work. No God there, those people, which one will I take at the end of the day? Which one would I believe? Samuel from LMA, welcome to the sunny side.
Good morning.
Good afternoon, Samuel. It's afternoon.
Okay, good afternoon.
Good afternoon.
I just want to contribute for what the first caller has just said. You know, there's something that happened to me years back. You know, when I got married, and I still about 7 years before pregnancy. So, and when my wife now got that pregnant, we now started the flowing of the blood. The flowing was just too much. So the clinic that we went to after that time said we should go and support the pregnancy. So, and my wife now said, upon now as we've been waiting for 7 years for her to go and evacuate this thing. And my wife is a medical practitioner, a night worker. And the pain was too much. I should take him back to the house. I should take him back. I should take her back to the house. So, and I took her back to the house. So, then I took her back to the house and said, we will not evacuate this thing. So, you believe that this thing will stop. So, I don't know what to do to ourselves and the process, because I met a worker. So, to cut the long story short, you know, the person that we are talking about now is 25 years old now. That the same pregnancy that we say is going to. And the person has not finished university that is about 3 years ago, 4 years ago now. Has even finished university. So, you see, you know, sometimes these people, they do something that is not, I don't know how to put it. So, that's my own contribution.
Samuel, why did you go to that clinic in the first place that told you needed to evacuate?
Because that time, you know, the anxiety that my wife is pregnant with, and again, the bleeding was too much too, because after that time, my wife cannot walk with her legs again. They are putting the leg to begin to crawl on the ground, and I just put it inside the vessel and take her to that hospital. That hospital, it was the closest hospital to us that time.
Closest hospital to you.
Yeah.
And before taking your wife there, you had never used the hospital before.
Exactly. I haven't.
Okay. Thank you, Samuel. From the 2 people that have, would I say, testified today, share their experience today, you would see that when there is an emergency, proximity is usually considered. But should proximity alone be the factor to be considered? What if it's not an emergency situation? What if you just feel a certain type of way and you know that you need medical care? I know certain hospitals that are very expensive in Port Harcourt, and they offer certain services. They are known for certain services. I know other hospitals who do not offer the same services that are not as expensive. In fact, if someone tells you that I paid XYZ amount to deliver, or XYZ amount to treat this, or XYZ amount for this operation or that operation, you will be shocked. Funny enough, they may not be big names. Oh, I forgot to add this on.
Stay with us. Nigeria Info will be